Today, I am thrilled to welcome a friend and a true trailblazer in our pharmacy profession, Dr. Chelsea Sumner. We actually attended the same school, UNC Eshelman School of Pharmacy, and while many of us took more traditional paths, Chelsea has forged a unique career at the absolute cutting edge of healthcare innovation. She works at the intersection of pharmacy and artificial intelligence, helping groundbreaking startups use technology to solve healthcare problems and also improve patient care. So she is the perfect person to talk to about the future of pharmacy and the incredible non-traditional roles that are opening up for us as pharmacists as AI continues to explode. So Chelsea, it is so good to see you and welcome to the podcast.
Thank you, Dominique. I'm so excited to be here, and I just appreciate the offer to share a little bit more about my journey.
What I didn't mention in the intro is that you actually work at NVIDIA. So before we get started on talking about what you do at NVIDIA, I want you to just give us a brief introduction about a little bit about yourself, your background, and a little bit about what you do, but not too much.
For sure. So I guess I can start. I wanted to be a pharmacist since I was 16. I did got my degree in clinical research before going to pharmacy school at UNC. I did a fellowship at Eli Lilly and Company before starting this role at NVIDIA 4 years ago, where I manage our healthcare AI startups for North Latin America and Africa. So that's the gamut, and happy to dive deeper into any of those.
Thank you, Chelsea. That was the expedited version of what you've done so far, but we're gonna break things down slowly as we go through the questions today. I am very curious because I haven't met any pharmacists who ever imagined themselves working in AI, and I don't even know if that was a thought when we were in pharmacy school. So, what was your initial reason for wanting to become a pharmacist? Like, where did you see yourself initially practicing?
Yeah, so I'm gonna just two questions in there, right? So the first one being that during pharmacy school, I had a friend, and he's very much the reason as to why I'm in this current role. But I used to go to do startup pitch competitions with him while I was in pharmacy school. So like that's what I would do instead of studying sometimes. They'd be like, oh, you know what? I need a break from studying. Let me go do this thing. And so I learned about the Internet of Things and just that technology is this powerful disruptor. And so I knew that from that point, like that there was going to be a way that I tied pharmacy into technology. I just did not have any idea. Now, that was at the age of, 20 plus. But I wanted to become, as I mentioned in the previous answer, I wanted to become a pharmacist when I was 16. We both have had the pleasure of meeting Dean Carla White, and I had the pleasure of being introduced to her at 16 during a summer program that I was a part of. Actually, along with two of my classmates. And it was so inspiring to hear her story because I think so often, especially if you're a student in this space or like a high school student or even a middle school student, like people will often put us in boxes to say, hey, you should be able to do X, Y, and Z, or because you're good at science and math, like this is the pathway that you should take. And so I've been told for a long time, like, oh, you should be a physician. And I'm like, well, what other options are there? And so she was the first person to give me this idea that there was something else that I could do beyond being a physician. And don't get me wrong, I love my physicians and my providers, like not a drag, but I love the ability that I could do, and pharmacy would open so many different doors. So I kind of knew that I wanted to be in a non-traditional type of role. So when I got my degree in clinical research, I thought I wanted to run clinical trials. I was fascinated with the Tuskegee experiment and Henrietta Lacks and wanting my family members, like my dad and my uncles and my brothers and my aunts and my grandmother, to get the best care and to know that the medications that they were taking actually not only were tested and like had efficacy for them, but just to reduce some of the mistrust that I see in the Black community, and like very warranted, but like wanting to make sure that we were involved in clinical trials. So in order to do that, I had to go to pharmacy school. So that's how I ended up in pharmacy school. And then you get exposed to so many different pathways in pharmacy. I thought about the traditional community pathway because I was working at CVS at the time, and I actually really enjoyed direct patient care. I thought about being an AM care pharmacist, and in North Carolina, of course, you have the opportunity to be a practitioner and to actually also dispense and prescribe. So I was really infatuated with that idea. But then I did do a BMS rotation, and that with one of my mentors, and that really sparked my curiosity in industry. And so the pathway was really pathwaying because I was like, I got options. And I really think that that was the thing. I knew that I had options, and that was what I enjoyed the most about pharmacy.
And you have to break this down for me because what is BMS?
BMS stands for Bristol Myers Squibb. It's one of the large pharmaceutical companies in the industry. So the advanced pharmacy practice experience is one of the fourth year rotations that you do. Not every fourth year does it, but I got the opportunity to do a rotation in the pharmaceutical industry during my fourth year rotations.
And so now you are in the intersection of artificial intelligence and healthcare. So where do we now get introduced to AI in healthcare?
So I became a fellow in the summer of 2019 after graduating, and my role was pharmaceutical project management. And so most people have no idea what that means. And it can be very ambiguous if you're anyone outside of Lilly. But what it essentially meant, and I got thrown into it, baby. Woo, I got thrown into it. I did not know what to expect. But I supported Humalog and Humulin, which most people know are short acting insulins, and it is a huge business for Lilly. And their diabetes business unit is one of the largest business units at the company. It is the largest business unit at the company, and so I supported the global team for Humalog. And so when I was on that team, I was the like youngest or the like in the reporting structure. I was sitting at the table with directors, senior directors for the different, we call them in industry functional areas. So HEOR of health economics outcomes research, commercial, so the marketing teams, the R&D clinical teams, the medical affairs team. So I was helping them to determine what their plan was for the upcoming year. And so that enabled me to see a little bit of everything. Even though I was on the more research and development side, my role gave me the breadth of knowledge of kind of how all the different functional areas work within the pharmaceutical industry. And one of the things that I just learned is that my scientific knowledge and ability to kind of like take a lot of information and distill it down to what's actually important, and the project management skills that I had from some of the leadership positions at Eshelman and even before Eshelman just allowed me to kind of say, okay, what is it that we need to take forward and move forward? But I'm working with people who are much more senior than I was. And so my mentor and I aligned my project the whole first year during my fellowship to switch over into the commercial organization, which at that time had not been done. Since then, I'm just really grateful to know that multiple PharmDs have been able to pivot into different functional areas, even without the degrees in those kind of specific areas. Like, I don't have a marketing background, but I was able to use the resources and just the learnings in the project that I had to be able to pivot into a marketing role without having to go into any of the kind of like other programs. So that gets me into my first job, which I actually during COVID supported insulin affordability, which was a really hot topic in a lot of ways. And so it was from there that I took on a brand manager position with my literal mentor, and it was amazing. But I then had a friend who was at NVIDIA at the time who kind of said, hey, you've always said you were interested in the intersection of how healthcare and AI, and we have a healthcare team. You should think about looking into NVIDIA. And so I'm like, okay, that sounds great, but I don't know anything about this company. But I was, again, like I said, interested in what the avenues could possibly be. So a piece of advice that one of my mentors at Lilly had given me was that I could not look at a, 50-foot view and think that I would be able to make decisions. And so he told me to always look at things from a 30,000 or 100,000-foot view to remove myself out of the situation and then make decisions. But also he challenged me to think about what it would mean to put myself in a really uncomfortable position by jumping instead of linearly from A to B to C to D, to jump from A to D to M to Q to Z. And so I took the leap. This was a jump for me from A to really M, because there is that would have prepared me for that transition into a completely different industry, despite the title being healthcare. Tech is very, very different. in just the traditional healthcare field. So that's how we get into my role, where I am now at the intersection, as you mentioned, of healthcare and AI, and really just technology. So it was a path, it was a journey, but hopefully that gives you some more insight into my personal journey here.
We've been using the phrase a lot. You're working at the intersection of AI and healthcare technology. Can you elaborate on that? What does that look like if we're explaining that to a fifth grader? Like, how will we communicate what you do to a fifth grader?
That's such a good question. And I think the caveat there is to a fifth grader. I think in pharmacy, we say, explain everything at the level of a third grader, a third grade education. And so if I had to say what the how to explain my role to a fifth grader. Luckily, my niece is 11, so she just completed the fifth grade. And if I had to tell Keenan to be able to describe my role to someone, she'd just say I take a whole bunch of phone calls about a lot of things that sound really important, and I talk a lot. But if I'm breaking it down for anyone else, I would say that AI is um, when you say "Hey Siri" or "Hey Alexa" or "Hey Google," as we hear really frequently, those are AI chatbots. And so what has made AI really popular is the ability to see AI everywhere today, where we probably didn't see it as frequently prior to 2 years ago. And so now we're seeing AI and the ability to say, "Hey Siri," or, "Hey, whatever." And I'm helping companies to be able to figure out what their Hey Siri is and to build the solutions that can help healthcare workers and in the healthcare space do things better and provide better care for patients like you and I or our family members, and to help them be able to say, I can use this thing that's not a person to get better care. And how can I do that? So I help with the how companies can do that, and really working at the kind of the place where that is happening at the beginning. So when a company wants to say, I want to help someone live longer, the how do you do that is what I help them to work on or figure out. They can have the idea, but what's the technology needed to help patients live longer? Or I want nurses and doctors to not be burnt out. How do we do that? And so my job is really to help figure out the how that can happen. Hopefully that was at the level of a fifth grader.
That was excellent. Thank you so much. And so it sounds like you have a big responsibility with knowing your technology really well, because you need to understand what your technology can offer, the things that you can do. And you probably have to know, like, well, maybe we don't have anything that exists now that does that, but like we're currently working on that, or I'm sure we would be able to, provide that for you in X amount of time. How does that come into play? What else are you doing in your role to make sure that you're informed and at the top of your game?
Yeah, the beauty of technology is that it changes on a daily basis. Like, I don't know what type of phone you have, but I have iPhones, and my niece has a newer phone than I do. And so she's always judging me. But I think about technology from the standpoint of like every year you're getting a new upgraded device. Every year you're getting something new. And so technology changes quickly, but the behind the scenes for how you get technology changes even more frequently. So if you think that you're getting a new updated device every year and the software that updates every 3 months, to iterate on that means you have to fail super, super fast. And so on the back end of that, it's about understanding that the world I live in changes almost on a daily, sometimes 3 to 4 times a day basis. The healthcare industry as a whole does not move at the same speed as technology, but how do we kind of bridge those two? And so that's really where the sweet spot is of my day to day is figuring out how do I help enable these companies to be able to leverage this technology and in a way that can then accelerate your day to day, either as a provider or as a patient within the healthcare system that doesn't move quite as quickly. So it's a really unique and fine line to balance of moving fast versus providing better care. And I will say that like NVIDIA is not a healthcare company. We're an accelerated platform computing company, and that's where we sit. And so we create tools that help others build solutions to be able to navigate and to be able to change their industries. And I think that's the beauty of what technology can do in this space.
It sounds like you are busy because you're having to keep up then with that pace. That's your job. And I know that just from talking to you offline, you would just share with me, I just traveled here and I just traveled there and I'm working in these regions. Can you talk a little bit about what you're doing when you're not at home working remotely in North Carolina? Where does the travel come into play? And we kind of got the day to day, but like, what does a week to week or month to month look like, and how does travel come into that?
As I mentioned, technology changes quickly, so my travel schedule changes on a week-to-week basis as well. And being that I sit regionally, I do cover North and Latin America. I mean, the U.S. is just vast in general, but we tend to think of like our technology hubs of being the Silicon Valley, so San Francisco Bay Area, which is also where NVIDIA is headquartered out in Santa Clara, California. Boston as a big biotech area. And of course, so like I spend a lot of time in the conference cities and we're in conference season. So a lot of travel to Chicago, a lot of travel to Vegas, when we can help evangelize the ecosystem. A lot of people still don't know about NVIDIA in the healthcare space. And so we're really and let me rephrase that, in the healthcare startup space and like our impact on building these tools to help startups change the ecosystem. So really working on traveling to those places where there are large conferences like the health conference that's in Vegas, or HLTH, RSNA, which is held every December, like 1st of December after the weekend after Thanksgiving in Chicago at McCormick Place. And that has the largest radiological conference in the world. So they see something like 60,000 attendees. So those are similar conferences that I attend. Of course, we got GPM in January, where NVIDIA is the only tech company that's invited to that conference. And then Bio Conference in June, typically is another conference that we have the opportunity to present and share a little bit more about what our ecosystem is doing within healthcare. So week to week, it's a combination of the day to day. So meeting with companies in digital biology and digital health and digital devices, including imaging and instruments, which is where we segment companies within healthcare, working to build out like how we support that ecosystem, which levers we use. Is it combination of like our higher ed and research teams or universities? Do we work with those, which we do? Do we work within government systems, which we've worked with the government of Barbados? Do we work with the large pharma companies like Pfizer, where we've had companies present to the Pfizer team? And other examples would be like working with Mayo Clinic and their Platform Accelerate Showcase for their digital health companies. So my day to day is meeting with those companies. My week to week is potentially traveling to those places. Month to month is usually conferences that kind of all fit those together. But the travel just kind of depends on the needs of the ecosystem at the time.
Your job is essentially being an effective communicator, and you're doing
Absolutely.
this on a phone call, maybe a one-on-one meeting, Zoom meeting, and then a large scale at conferences in front of large audiences. So you have to rotate out different types of communication skills and be very comfortable presenting in front of big names. And I am curious, and I'm pretty sure some people are still wondering, like, but like, what are you doing as a pharmacist? Like, where are the pharmacy school skills coming in? Excuse me. I hope you don't mind if I cut in for a moment.
Hurry up.
Number one, thank you for watching. I hope you're learning something new in this episode. Number two, which is the reason I'm here, is if you don't mind, could you be so kind and like this video or hit the subscribe button?
I mean, I've always subscribed.
By subscribing, you're letting YouTube know that my content is providing you value, and that ultimately helps the channel grow and reach more people who need to hear these conversations. You can also subscribe to the Pharmacy Pathways newsletter to get access to exclusive episode content, Newsletters go out in the same week of the episode. You'll receive a structured summary of each interview, expanded guest bios, and exclusive sneak peeks of future episodes. Subscribe at pharmacypathways.org. Link is in the description. Oh, and one more thing.
Hurry up!
If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Okay, let's get you back to the show. You know, where are the drugs coming in, the disease state? Where's it coming in?
Yeah. Oh, that's such a good question. Yeah, I get that question all the time because there's not, I'm pretty sure I'm the only pharmacist at NVIDIA. I have yet to meet another one. So, out of all of our employees, I'm the only one. And so when someone finds out, especially if I'm talking to like a biotech company or a tech bio company, they're always like, oh, you're a pharmacist, you get it. Or even in sometimes with the clinical digital health company, they're like, oh, you're a pharmacist, you get it. And so I think that that's sometimes a connector, especially when you have physician founders or founder, like I do know a couple pharmacist founders, that kind of immediate connection to understand like why they're solving this and what problem they solve. Like companies are created based off of a problem. So I think that's the tie to pharmacy. We prescribe based off of a disease state or a diagnosis. And so it's that ability to be able to say, let me think of what the best options are to provide an intervention. Like I'm geared to be able to think that way with a startup of like, you're solving this problem. Like, what are the tools that I have within my power and resources for help you to enable the solutions that you're building? So I would say that's probably the first thing is like, yes, it doesn't always look exactly the same, but there are a lot of very translatable skill sets within my current role that I picked up through a lot of the things that I do. I would even say going back to pharmacy school, OSCEs. So for students who are familiar with the term OSCEs, I forgot what it stands for, but like you literally practice presenting to a provider your rundown of a soap note. So what's the like? Is it subjective, objective?
Assessment and plan.
There we go. You're gonna run through all the things of like what you recommend to a provider for how to treat a patient or how to, what's the best plan of action for a patient. And so it's kind of the same thing. I need to be able to think through like what is this what problem is this company solving? How much funding do they have? Where are they located? What does their team makeup look like? What solutions are they building? Do they have the right resources that they need? And if they don't, how can we enable them with the tools through our Inception program or our partners to enable them to accelerate? So like I'm providing that plan. It's the same thing as like, what's the intervention that you're going to give? Like a provider doesn't care that you've ran through all the things of like this person's HPI and all the things that were in every other note before you got there, but they want to know like, what are we doing? So it's kind of the same thing. I do spend a lot of time presenting to, larger audiences and smaller audiences. So I do think I use like every form of communication possible, like how well are your verbal and written skill sets, which again, you get a lot of practice of that in pharmacy school is presenting information. How well can you articulate complex things and distill it in a third grade level to someone else as to why? Behavior changes is always going to be something that you are focused on because I think most people have the misconception that pharmacists are here to give you drug or to push drugs because we just want to see people be sick. I think that that's one of the main misconceptions about a pharmacist is that we really actually do care about lifestyle modifications and management. And that is not pushing a medication. That is making sure that you make behavior changes to have a better quality of life. And so that's, again, the biggest thing that a lot of people think about from a technology standpoint. You don't need all technology to be able to make better solutions, but can you distill that in a way that makes sense to someone to make sure that they understand why they would need to build it this way or how they would need to build it this way? And just making sure that we can communicate really complex information. Like you probably have no idea what it means to like think about a GPU and how you scale that up and or a large language model so that someone can have an AI chatbot. But like being able to distill what someone and what a company would need to be able to build those type of solutions is something I need to be able to articulate to the CEO or the CXO. So like whether you're the chief executive officer, you're the chief finance officer, the chief business officer, or if you're a data analyst or a data engineer, like I need to be able to distill whatever information to you in a way that you can comprehend it in order to have the behavior or to have the influence that to help you adopt the technology that you need to be able to adopt. And so I think if I had to distill it down to like three things, it was like communication is vital to any role that you're going to do, not just in pharmacy, but any role that you're going to do wherever you're going to practice. The ability to take complex things and make it simple for someone is also going to be a skill set that is transferable just across the board. And then I think finally, the last thing I would say is like that patient level behavior influence. I don't know what the soft skill of saying like, oh, I can connect to a person, like to treat people and not as technology or as systems, and that you hear what they're saying and how they're saying it is going to get you much further than the like being rude or being angry or being short with someone.
Essentially, the last one that you're getting at is it's actually active listening and understanding their point of frustrations. Sometimes they're not even communicating what they really need. You actually might be listening to what they're saying and you realize that what they need is actually different than when they think they need. And that's what you're there to break down and give back to them.
For
That's
sure.
wonderful. And to me, that sounds like health literacy, adjusting your language in a patient room based on their health
Thank you.
literacy.
Yeah. Their tech literacy is what I'm working on. That is the transferable skill set. It's a health literacy. Yeah.
I want you on your side of things to address the upside of AI and the role that it's playing in the world of pharmacy. We hear too much of the negative. I want to hear from somebody who has that different scope, that different lens. How can AI and the growth of it actually support us as pharmacists and create new roles or change our roles to be more enjoyable?
Yeah. I think I can take that a couple different ways, and I'll even start like back at my experience at CVS. So I worked for CVS for about 7 years. And again, it was such an interesting experience. It was probably one of the hardest jobs I've ever had, but also one of the most fulfilling for a couple different reasons. But I'll take that as an example. When I first started at CVS, there were no automated counters. So every single thing was counting by hand. So if I had to count out 360 for a 90-day supply of gabapentin, like I was counting that out by hand. And so I was so excited when they brought in these automated counters and we only had one. If there were 5 people working in a pharmacist, like in the pharmacy, like there was only one. And so that sucked if you had to go count it by hand, like if the pharmacist needed to count something out. But like, the automated counters is probably my best example of like a piece of technology that wasn't there because people were like, oh, you just count pills. It's like, no, that pill counter allowed for the pharmacist to be able to take more time to spend time with counseling patients and to go through and call providers as the last line of defense for a patient, whether a medication error could occur, like that last line of defense is so important. So just the ability to know that introducing new technology can augment our roles and not stress as much about the replacement of them because it just opens up additional opportunities. I think we highlighted this a little bit earlier that most people don't know what a pharmacist does, or we are segmented into what someone can see a pharmacist in. Like, no one would put a pharmacist at NVIDIA on a healthcare team working in AI, but we can reimagine ourselves anywhere. Now we have these different options and these different things that are available to us. I think it goes back to kind of like why I chose pharmacy to begin with. We have options and to let people know that there are options within our field so that we don't just silo ourselves into a box that someone else has placed us in because that's what we've done traditionally. So I think the second thing I would say with this is just that when you think about pharmacy and AI and a lot of the fear mongering that comes around with, oh, it's going to take our jobs, I always tell people it's not going to take your job, but someone who knows how to use it will. Because if I'm a pharmacist that knows how to make my workflow more efficient using AI, I'm going to get more done. I'm going to be more productive in the same 8 hours that you and I have. One of us is going to output 3 times or X amount of times more than the other. And so, why would I not want to hire someone else that can do that same thing? So, there's a very clear need to upskill our skill sets to leveraging AI as an efficiency booster, a productivity booster in our current workflows. And so it doesn't always have to be the threat of something. It can be an assistant and a helping hand to the workload that you currently are taking. Because if I'm honest, everyone in healthcare is burnt out, regardless of what sector you're in and regardless of the type of work you're doing. We're all tired. I think COVID exacerbated a lot of that. But whether you work from home, you work in a hospital, you work in a clinic, you work in something like in a place where you're doing direct patient care, and even if you're doing indirect patient care, we're tired. And whether that's like Western culture or whatever, like technology does have the ability to lift some of that burden that we're currently taking on in ourselves, especially if you're a provider or clinician of any sort. Anyone is going to look at the ability to spend more time with patients and providing better patient care as a win and not as something to be feared. Because again, at the end of the day, the decisions that we make do determine sometimes whether someone lives or dies, and the decisions that we make have downstream effects to someone, whether they live or die, if you're in the healthcare space. And so we want more people to live and to give them the best quality of life. And so I think that that's where technology plays a part. And
Something that kind of hit me as far as how AI could make my life easier is when I was actually on a call with my doctor. I see my PCP remotely, and she was like, "Oh, I just want to let you know now that AI is going to be assisting my note taking, and it helps her write and summarize the encounter." And I was jealous. I'm like, "Hold on, what?" And ever since she told me that, I'm at work almost every day, like, man, I wish AI could just, cause documentation, I'm pretty sure almost every healthcare provider who sees patients, that documentation in itself will make you question whether you picked the right career. It just takes away from so much patient time from, to your point. And that's like a specific example that I can think about of how that would just transform the game when it comes to burnout in the healthcare industry. We're being asked to see a lot of patients, touch a lot of patients on a daily basis and accurately document, make sure that we're capturing everything and be
Mhm.
effective in that encounter.
Yep.
So I could see this completely changing the game.
So,
I do have
in fact,
oh, go ahead.
so fun fact about that one, that's actually one of the major use cases that we have. And so we have a company that we're partnered with, a bridge, which a lot of people have heard about a bridge this year because they also just, closed a $300 million round earlier this year in the first half of this year. That is what they do. A bridge is integrated with Epic. And so I'm not sure if all Epic platforms have it, but they are clinical documentation. So they serve as an AI companion for providers where they can help you streamline your documentation. And so they listen in, the AI agent will listen in and scribe and transition your speech to text or text to speech to be able to help make that clinical encounter easier. And then it makes it just so much less burden on a physician. Because, like I said, I remember writing notes after encounters and it takes forever. So just like you said, that does change the game for a provider that doesn't have to, type everything out and make sure it's integrated back into an EHR. So you're going to see that a lot more clearly and becoming more mainstream. So be patient. It's coming down. It's coming.
Praise God. Won't he do it?
Only do it.
I want to go back to, um, you said that this change of role for you back in the beginning of our conversation, you said you jumped from A to M. And while you while you skipped the standard steps that people typically might have had to traditionally take, I'm pretty sure you were consuming water out of a fire hose.
I'm still consuming water out of a fire hose.
So I'm sure that's a challenge in itself. But what other challenges are there just trying something new in general where there really isn't a clear roadmap? You kind of are the first person who is trailblazing this path. How do you find mentors when you are the first person who is creating the trail for others to follow? What does that look like? What are the challenges in that?
I think the first challenge is just myself, right? Like the fear of making a decision where there is not a clear roadmap. Again, traditionally, you think of pharmacy as clinical pharmacy, where you're going to go into a community or a hospital setting. And so, back when I was in pharmacy school, the non traditional route was for the pharmaceutical industry and still kind of is. But now we're seeing more pharmacists in that space. So you have an idea of like, oh, let me go ask this person, or let me ask the fellow and ask them this question, or oh, let me go ask the resident, let me ask this question. I didn't have that moving into tech. And so the first thing is like fear of there's no one that I can ask, am I making the right decision? I'm literally trusting God and I'm leaping. And, you know, uh, my favorite Bible verse is Hebrews 11:1. And the premise of it is that faith exists whether you can see it or not. And so to not know a path meant that had to lean mostly and to majority on my faith that I was making the decision that God put me in the place that he wanted me to be in. I'm a firm believer that he doesn't call the qualified, but he qualifies the called. And so I knew that I was well positioned to be able to handle anything that could come. But that doesn't mean that you don't still have fear. And the fear can keep you or paralyze you from moving. And so I'm grateful that I wasn't paralyzed by not moving at the time and the opportunity, because 2 years later, after I had made this decision, or not even 2 years later, but a year and a half later. I started in June of 2021. And by December of 2022, when ChatGPT launched, everyone is like, oh, now we understand why you made this decision. Like, you are in the perfect place. Like, this is the company. Like, NVIDIA is the backbone for AI. Like, wow, how did you have the foresight? And it's like, I didn't have the foresight. Like, I literally just like leaned out on faith. Like, okay, this is something I think makes sense and this is going to cause me to grow. But I do know that growth is something, I don't know how I want to phrase it, but growth is something that anyone can do. It doesn't mean you have to have a certain skill set, but it's also it's something that you can learn from people who've also placed themselves in positions that have forced them to grow. I also think that, again, where that fear comes in, you kind of have to, I would say, not shrink, but you do have to curl a little bit more inward, because your ability to be able to bloom, to blossom, to come out of a cocoon requires you to have to tighten up on a lot of the things that you were doing. And so I would say I was a little more outwardly focused, a little more out loud, and I've had to be able to learn at the speed in which I need to learn. I've had to like draw a little bit closer into myself just to remain focused and to remain like clear on like this is where God has placed me. And so having mentors and seeking out mentors that are in places or positions that are higher than I am, that can point out some of those pitfalls that I could potentially fall into shifting into a new industry. I'm not the first person to shift into a new industry. So who else has done it, and how can I learn from some of their early mistakes to not repeat them? I'm not the first person to, have a doctorate degree and then have to start over from scratch of learning new material. So who can teach me how to pick up and come up to speed a lot quicker? I'm not the first person to need to communicate and have better communication skills. It's actually something that everyone has to work on. So who can teach me, and how can I work on those communication skills? So I started looking for mentors that were in positions that I either could see myself in, or positions of influence that I could leverage some of their previous experiences to grow from. And also just peers who were doing challenging things and peers who were like, oh, I see you doing this, keep going. Because, like I said, you can paralyze yourself in not doing something, and you want someone to be able to look at you and say, girl, I'm so proud of you, or guy, like, bro, keep up the good work, like you
Mhm.
can do this. So that's equally as important as finding mentors that can guide you. It's just as important to have people that can see that you are struggling and doing something different and support you as well.
I love that. That was sound wisdom right there. And what I heard from what you just shared is, if we try to find someone who is going through our same exact situation, same exact problem, it's going to be very hard to find a mentor. Not saying it's impossible, but it makes it much harder to find that person who can provide the solution to that answer. But when we broaden and step back from the situation, and we really get clear on what the actual problem is that we need help with. My question is not, how do I learn all of this technology information? My real question is, how do I learn this completely new industry that I haven't been trained in yet? And that's a much broader question that a lot more people can come with a sound answer to your point. And so it sounds like you really kind of had a clear idea on what your real problem was. Because this was a new space for you, you were seeking people who just had to solve similar, broader problems.
I'll add, like, I knew that I wanted to be a leader. So, like, you have to make a early decision of whether you want to be a people leader or not. And that to me is what a manager is. A manager is a people leader. Like, you're going to figure out how do you take a person and help them to navigate their own challenges and pitfalls. That was something I had identified for myself very early on in choosing to do leadership, because you do have to choose leadership. You can get thrown into it and, like, yes, there's a course, but you still have to choose it to stay there, right? And so I talked to enough leaders when, especially during my fellowship year, where they reminded me that, like, that's a very lonely position to be in, is leadership, because you will start being pulled in different positions that you don't have any experience in, and you're going to have to lead people who are experts in that field. And so that's not something that's novel to, again, any particular industry, even any particular job. It's something that if you choose to be a leader, you're going to have to get comfortable in being uncomfortable and not being the expert. And so finding leaders who've made that transition, who are, still strong leaders despite not being a pharmacist. I don't know, Dom, if you've seen it, but like people who are leaders that are leading whole teams of pharmacists and have no pharmacy background, I know knew that that's the skill set that I needed to be looking towards building. And the people that I wanted to be guiding me through that had to have uniquely done something similar.
You're not leading the you're not leading the topic. You're leading the giftings and the skills of the people who understand the topic. That's good. That's good. And I wanted to ask you, you mentioned you had to kind of curl into yourself. Did you mean like you had to say no to social invitations, more time locked in, blocking out the noise mentally? Where were you coming from with that comment?
It's probably a combination of both, right? I actually ended up getting off social media in that same December of 2022, because there's a lot of noise in technology, and there's also a lot of data. And so you start realizing how much data you make available about yourself with the use of social media. So part of it was like I needed to block some of the noise. And also, I was giving up a lot of data for these algorithms to be able to just feed me additional information. And so I was like, I don't know how much of this, like, I want to be able to control a little bit more of that for me, right? So part of it is just like I needed to reduce some of the noise because I wanted to be able to do a good job by the companies that I was working with. I wanted to be able to see the ways in which I could support them, and I wanted to learn about our technology, and to be able to help them understand how to use our tools. So part of it was that. But then also to your point about like just saying no to certain things, is like knowing your boundaries, because you're taking in so much information and you need to be able to say no to something so that your yes has meaning to it. Because if you're saying yes to everything, then your no, it just, excuse me, then you don't have as much power that when you do say yes to something and you're able to say no, you're very confident in why you're saying yes to something and you can explain it to someone else and you feel comfortable in it. Like you don't feel like you have any shame or guilt or you need to over explain. Like no is a complete answer. And I had to learn that. Like I can't be in a million and one places at all times. Yeah, I wanted to make sure I was presenting the best version of myself.
When you're learning a new task, that takes mental energy and physical energy. You have to say no to things and also understand that it's for a season. And if you
Mhm.
really understand that this isn't forever, my social life isn't dead right now. It's just, I just have to let my people know that I gotta, I won't be out as much. My text messages will be delayed. Don't take any offense. I'm putting my phone on sleep mode in the middle of the day. You have to have boundaries, and I'm still implementing that in my own life right now. And it also sounded like you had some people questioning whether you were making the right decision from a comment that you made. They said, "Well, I didn't really get it at first, but now I see it. So good job." How that type of commentary, if you're easily swayed by people's opinions, or if you fear can be contagious, is contagious, I should say, not can be.
It's contagious.
When people project their doubts onto you, their fears onto you, you can take that on and start to question everything that you once thought that you were very confident in. So how does one know? Because we're addressing people who are thinking about either getting into AI or completely going into another field. How do you know when you're making the right decision, despite the obvious things that could go wrong, right? Like you're aware, nobody needs to tell you. So it's not helpful. It's not helpful when they do.
I don't think I have a good answer, right? Because I had mentors being like, Chelsea, I don't think you should do this. So I, yeah, like the people I trusted most in some cases were like, don't do this. Like, why would you do this? Or you're on this really great path and trajectory of this thing that you said that you wanted. Like, we can give that to you. I'm going to take it spiritual for a second. The devil can give you blessings. And so, like, I think that to me is one of the things that I had to be like super attuned to in just my spiritual life of like, okay, I don't know the answers to this. I don't know. And being honest about that, like I don't know, and being again confident in my I don't know. I didn't know the answers. I didn't know that, but I also knew that I had left really good impressions on the team that I was leaving. I had left really good work ethic. I had left a really good business relationship because I do think it's important that you don't go burning all the bridges down to try to prove something to somebody where you, especially when you don't know. But it was like I always knew that I could go back into my clinical degree and go work at CVS or go back to working in the pharmaceutical industry. But I also had the opportunity to go do something different. So there's a little bit more of a confidence that you have of like, I can go do this and see, and it won't kill me. Like, whatever won't kill you, you can always go pivot. And I don't think we always take the agency that we have within ourselves to go do something different that doesn't look like the norm. I do a lot of traveling. And so part of my love of traveling is when you get to meet people. And so I spent some time in Colombia a couple years ago. And the majority of people I met were like 5 to 6 years younger than me, early 20s. And they were like, "Oh, yeah, I'm just here because I wanted to make sure I explored the world first and had a perspective before going into a workforce that was gonna limit my perspective." And so I think that stuck with me of like, I didn't have the words for it at the time, but I knew that by doing this thing that was very, very different, that's not your traditional pathway, that I was opening the door to not limit myself. And so that would be the thing that I would showcase is like, you don't have to know the answer, but if there's a possibility that you're going to limit yourself and put yourself in this box that we tend to place ourselves in, we have the freedom to open up the box, or even better, think that there's not a box at all. And I would just want to encourage the next generation that you don't have a box. Like your ability to be able to go and do and be anything was something that my parents inspired in me as a child. And like that's what I would love for us as people to do a better job of is like you don't have any limitations and you only have the limitations in which you put around you. We can always change what you can change, that you have the power to change.
That is a word. And another thing is people love to make commentary on your life, but they get off the phone with you and they go about their business and they don't have to
You
live
have
your
to live
life.
that life. Mhm.
Yes. And one thing I personally like to do is I like to like that so Raven, like different scenarios in the future. Like
Yes.
what will Dominique think if I don't do this in 5 years?
Mhm.
And will
Mm.
Dominique be grateful if I did do this in 5 years? And personally, I rather live with the I tried and it didn't work out than I wonder what would have happened. And also, we there's different things that people have to consider, right? You and I don't have
Yeah.
children, so we have more flexibility.
Right.
So there's other things that weigh into your decisions. I do the pros and cons list. I'm old fashioned. I write it out, and
And
then I
I have the
also
pros and cons list beside me.
yeah, and I also I seek God on it, not to get spiritual again, but I do. I seek God on it. If I have a peace that literally surpasses understanding, like I can't even understand why I have peace about it because when I look at it, it looks crazy. Or when I think about it, it looks crazy, like a crazy decision. That's when I know that this is probably the direction I should go in. So let's give them three actionable things that a practicing pharmacist can do, a pharmacy student can do to start looking into this industry and scoping out potential careers that they could have within AI.
I think the first thing is everyone has access, whether through school or whether you pay for it, of just the basic learning. So, Coursera, LinkedIn Learning, there are so many different platforms for learning. Know how to do prompt engineering. Like that's the first one. And when I say prompt engineering, that means like the Chat GPT, the thing that you ask Chat GPT to give it an output, it performs better based off of like how you talk to it. And that's the same for whether you use ChatGPT, Gemini, Perplexity, like you pick the platform that you use. I know a lot of students use, I think Claude for, just texts and documents and stuff like that. But, pick your platform for the large language model and learn how to do prompt engineering well. And then use it. Your day to day should be using an AI tool. Again, pick the one that you want to use that you're most comfortable with, but use it to figure out your workflows. I have friends that use it for building out their travel. I have friends that use it for, hey, here's my schedule for the day. What are the things that I should be not working on and put it in priority order? So that to do list and that pros and con list, make me a pros and con list for this. If you can prompt engineer that and use it effectively, you're going to make yourself just more efficient no matter what you are, whether you're a student, whether you're a pharmacist or in between, like it doesn't matter. Anybody can use the tools. So that would be the first one is use your tools and get better at prompt engineering. Now, the second thing that I would say is that this space is ever evolving. So what may be relevant today, like most people are like, oh, Chelsea, do you code? I don't code because there are tools that are available now that can do the coding for me. So platforms like Cursor and different things like that. But I would say don't spend as much time on that because that has been automated through the tools. So that was more of a like what not to do. But the second thing that I would suggest doing is familiarizing yourself with what is available in your workplace or what you can then leverage. Start leveraging the tools that you have available and see what's available in your environment. Every company now has an AI strategy. Go find a team that's working on AI. So whether you're a student or a pharmacist, somebody is using AI, go do work with them so that you actually can get experience to see if this is something that you want to do. You're going to be using it. So let's figure out how you can have a voice in it. And I think that's the third thing is have a voice. So if you're using these tools, find ways to give feedback because that's what's needed to make them better. They're not going away. So how you can use your voice to provide feedback. Do you notice biases in systems? Did you notice that it gave you an incorrect answer? Did it hallucinate? What are the things that the system is doing, and can you provide feedback about that to the person, preferably to the person that's creating it, or at least into the team that's asking you to implement it? I know that most of the data scientists and data engineers for companies are looking for people to give them feedback about the tools that they're building because they genuinely want you to use them. So, first thing is be really great at prompt engineering so that you can use the tools. Use the tools. Find the company in which or the place in which you can start using the tools and then provide them feedback. Use your voice.
Wonderful. And you also said Coursera, and I'm going to bring that back in because if for those who don't know, it's called Coursera because it's just a host of courses of just about anything. And they do have a lot of AI courses on there for people who like more of a structured learning and not just like freeballing it on the internet with a Google search. That I'm talking to people like me. And that those courses are free or super affordable. If you stop by in Starbucks every day, you could afford a Coursera course. So just wanted to plug that in just in case they missed it. All right, that's all that I have. Did I miss anything that you think they should know before we wrap up today?
Think so.
All right. We got the technical nuggets, the spiritual nuggets. I want to thank you again for spending your time to give insights because I know you're super busy. Thank you so much for being a resource for those who are looking to get into this space.
Absolutely. Again, just thank you for the time and opportunity to share a little bit more about my story. And I hope that if it resonates with someone, that you don't have the fear of like limiting yourself, but have the inspiration to go do something that you couldn't dream was possible.
Before it was a traditional path, it wasn't a path at all. And somebody had to walk it for the first time. So why not you?
Why not you? That's the
Why
question.
not
Why
you?
not you?
Thank you, everybody, for watching. Stay blessed and stay curious. We are out. You just watched an episode of Pharmacy Pathways, a podcast created to help current and future pharmacists find their happy place in life. I'm your host, DomThePharmacist, and I interview different pharmacists from various careers, asking them the questions you'll likely need answered in order to know if that particular role aligns with your interests, passions, skill sets, and talents. If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Thank you for watching. Stay blessed and stay curious. I'm out.